If you're a clinician, you're a storyteller at heart. Every single day, you see these unique patient journeys unfold. But what if one of those stories wasn't just a story? What if it held the key to a real scientific breakthrough? Today, we're going to dive into how to turn those powerful observations into actual published science using the medical case report.
I want you to think about it for just a second. Have you ever had that patient who didn't respond to the textbook treatment, but then they just thrived on something totally new? Or maybe someone presented with a super common illness, but in a completely bizarre way. Those moments, they're not just interesting little anecdotes. They're the potential seeds of brand new knowledge.
Okay, so check this out. A clinician noticed this massive improvement in a patient's anxiety and their hypoglycemia, all after changing their diet. Now, instead of just making a note in the chart and moving on, they wrote it up. And now, it's a published, cited scientific paper that's contributing to nutritional psychiatry. It could even spark larger studies down the road. This is the kind of power we're talking about here. So that single observation made a huge impact. But let's be real for a second. What's in it for you? Why should you go through the trouble of sharing these cases? Well, as we're about to see, the perks go way beyond just adding to the scientific literature.
Okay, think about the time and money and pure effort that goes into a giant clinical trial. It's a mountain. A case report, it kind of sidesteps all of that. It's a much more focused, totally achievable project you can knock out pretty quickly. It's one of the easiest ways to get a publication on your CV for sure. Plus, it's a fantastic way to mentor a student or a trainee and give them their first taste of scientific writing.
And yeah, it's great for your career, but it's also a genuine contribution to science. Think of each report as one little piece of a giant puzzle. Sometimes, that one piece is all it takes to convince someone to fund a major study. And here's what's so important. Case reports capture something big trials often miss: that messy, real-world complexity of patients who have more than one thing going on.
Okay, so the benefits are pretty clear, right? But before you can write a great report, we've got to nail down the basics. What is a case report really, and what makes it such a special tool in the world of science? So at its heart, it's really just a structured story. You're laying out everything that happened with a single patient. The two big phrases to remember here are real-world setting and care that has already been delivered. This is all looking back. You're a reporter, not an experimenter.
So how do you know if your story is worth telling? Well, it could be a bunch of things. Maybe you saw a super rare condition for the first time. Think about the early reports on the Zika virus, right? Or maybe a common drug had a really weird side effect. Or you used an old therapy in a brand new way. Basically, if you look in the literature and it's not there, that's your story.
Okay, so now that we know what it is, we need to understand where it fits in the grand scheme of science. And to do that, we have to talk about something called the hierarchy of evidence. So picture a pyramid of scientific evidence. Case reports, they're right down there at the bottom, the very foundation. And yeah, they're at the bottom, but that spot is so important. They're the spark. A case report can't prove a treatment works, let's be clear about that. But what it can do is generate the idea, the hypothesis that leads to all that other research higher up the pyramid.
And because they're at the bottom of that pyramid, we have to be super honest about what they can't do. The experience of one single patient might not apply to anybody else. It might not be generalizable, as they say. And there's always a chance of bias or that something else entirely caused the outcome. The key takeaway? It's a clue. It is not a conclusion.
All right, so you've got a great case. You get where it fits into science. Now for the fun part, the how-to. How do you actually turn that story into a proper report? Let's break it down, step by step.
And the good news is, you don't have to make this up as you go. There's a standard formula, a roadmap you can follow for the whole thing. We're going to focus on a couple of the key sections where people, especially first-time writers, tend to get a little stuck.
First up, the title. And this is like rule number one, okay? Always, and I mean always, put the words case report or case study right in the title. Don't get clever, just put it in there. It instantly tells everyone, editors, readers, everyone, exactly what they're about to read. No confusion. Okay, here's a big one where people get mixed up. The introduction versus the discussion. Think of it this way. The introduction is the before. It's where you say, here's what science already knows, and here's the little hole in that knowledge that my case is going to talk about. Then the discussion is the after. After you've told your patient's story, you come back and say, okay, so how does my case fit into everything we already knew, and what might this mean going forward? Right in the middle of those two, you have the heart of your paper, the case presentation. And the key word here is objective. This is your just the facts section. You just lay out the patient's history, what you did, and what happened. No opinions, no I think this means, none of that. Just tell the story. You'll get to interpret it later, I promise.
Which brings us to the conclusion. Remember how we said a case report is a clue, not a conclusion? This is where you really have to show that in your wording. Be cautious. Be humble. You are not proving cause and effect. So instead of saying, treatment X cured Y, you write something like, this report shows a case where treatment X may have improved outcome Y. See the difference? It opens a door for more research. It doesn't slam it shut.
All right, we are almost at the finish line. Before you put pen to paper or fingers to keyboard, let's go over a few final, super important checks to make sure your report is solid, ethical, and ready to go. Okay, listen up because this part is absolutely non-negotiable. This is all about protecting your patient. Number 1, you must have their written, signed consent. No exceptions. Number 2, you have to scrub that report of any and all identifying information. Anything that could possibly point back to them, get rid of it. And third, check with your institution. You might need to get approval from an ethics board, like an IRB. Your patient's privacy is everything.
And here's some more good news. You are not alone in this. You don't have to reinvent the wheel. There's an amazing tool called the CARE Guidelines. It's basically a checklist that the whole world uses for writing great case reports. Just use it. It'll walk you through everything you need to include, making sure you don't miss a thing.
And finally, a little pro tip for you. Once you think you have a final draft, find a colleague, someone you trust who was not involved in the case at all, and have them read it. Seriously, you're too close to it. They'll find the confusing parts, the stuff you forgot to explain. A fresh pair of eyes is just invaluable. It can honestly be the difference between getting published and getting rejected. So, let's bring it all home. I want you to think back through your own practice. Think about those patients who really stuck with you, the ones that surprised you, the ones that challenged what you thought you knew. Their stories matter. They have the power to push science forward. So the only real question left is, what story from your practice is just waiting to be told?